Knock, knock. Any little guinea pigs home? Oh, I know you're closed. I'm not here for coffee. Mm-mm. I'm here for you, silly. Yes, I know I wasn't called and I wasn't invited. But you had me worried. You think I don't own a television? I know I might be older, but I'm not that old. Plus, with everything happening in the world, I like to keep up on current events. Especially seeing as the fact that a certain little guinea pig seems to get into a whole lot of trouble. You're gonna try to play all coy. I saw you on the news with quite a busted up face, if I do say so myself. Now, what if I told you about taking care of yourself? That's right. I said to keep that in mind. Make sure I don't have to do any more house calls. I know you didn't call me, so I came to you. Stop. As always, it's free of charge. How did I know that you weren't treated? Well, I would consider us friends, wouldn't you? Come now. We're friends, you and I. I mean, we've been very, very close, haven't we? And I know so many things about you. What's inside? Okay, I'm teasing. I know your blood type. I know your allergies. I know, things you're allergic to. At this point, there's more things I know about you than probably your closest little friends. Wouldn't you say? And I think that makes us close, like this. Not only do I know all these things about you, guinea pig, I also know the fact that you, how can I put this nicely? Well, not too nicely. I'm not that nice. You have a habit of not getting yourself treated. Why? Why do you think that is? Is it because you don't want to be a burden? You don't want to be, distraction? Too late for that. Have you seen your face? Even all busted up as it is. So I knew for a fact that you wouldn't go with the medics that were on site. Am I right? Stop looking so wide-eyed and innocent, guinea pig. I told you I know you. I'm not a mind reader. As much as people like to say that I have powers beyond this world, powers of the damned, a reaper of sorts, that is not actually true. You know that, right? Stop. Now who's teasing who? If you start saying such nice things about me, I might not be so nice back. But I'm not here for that. I'm here to treat you like the good doctor I am. Now, I'm gonna guess you didn't get treated, you didn't get seen. You just came straight home to your little attic bedroom. Didn't even take any medication, am I right? Again, not a mind reader. Just a concerned doctor and close personal friend. Well, let's see what I have for you. Uh-huh. For you. And I want you to take 4 of these. How many did I say? That's right. 1, 2, 3, 4. 4 of these. Okay. And don't worry, it's nothing crazy. It's just something to help with the pain. And something to help with the swelling and possible headache that you no doubt have. Again, not a mystic. Nothing supernatural. Just concern, and I'm very, good at my job. Wouldn't you say, guinea pig? So, take 4. Do you not even have water? Give me a moment. Your boss won't know that I took something, right? Good. You can wash it later. I'm back. Ta-da! Now I expect you to drink this with your, how many pills did I say? That's right, 4. 1, 2, 3, 4. That's correct. Here you are. Drink up. Did you take them? Good. Say ah. What, I have to be sure. I don't want you saying you took them, but it's secretly hiding underneath your tongue or on the insides of your cheeks. Good guinea pig. I said drink the water. I didn't say take a sip to take your medication. I said drink it. You're probably dehydrated, so finish it. There it is. I do love how obedient you are. Especially when you don't feel well, and I'm very sorry about that. Don't worry, you're not a bother. Honestly, you're helping me as much as I'm helping you. Isn't that right? We have a contract, you and I. Oh, no. Don't say that. You make me sound like I'm your keeper or something. Did you really think I was waiting around, skulking about the place, waiting for you to come home? Why, I will say you did give me a fright after I saw you on the TV. Seriously though, what are you and those little friends doing? That's right, your secrets are yours, my secrets are mine. You have me curiouser and curiouser by the day and night. Then you can just set the glass over there. Did you finish it? Good. Now, those pills should start working in about 15 minutes or so. If you still feel uncomfortable, well, you're gonna have to wait another 4 to 6 hours before you take more. Don't worry, all those pills are yours, and they're just over-the-counter things. Again, nothing crazy, nothing that might make you uncomfortable or pass out, like my pills normally do. All in the name of science, of course. Again, I'm trying to create a potent, we say super drug. Some people would, but certainly something that should be helping people. Hence the reason why you're helping with my trials, right? Alright, let me go get gloves and we'll start by taking a look at some of those bruises. Be right back. Don't move. Thanks. I'm surprised they let you walk away, by the way. I mean, if I were there on the scene, I would keep you nice and snug, where nothing else can get you. Again, it's because I like to take care of my things, guinea pig. I like to count you among my things. Stop. Though seriously, how did you get away looking like that? You had one of your little friends run interference. Let me guess, so they wouldn't ask too many questions. I'm right. Oh, trust me, I know all the tricks. Comes with being a doctor, as long as I have. Watch it. Don't call me old. It's not my fault that you're so young. Honestly, though, you're very mature for your age. Sometimes I forget that you're still in school with your little friends. Alrighty. Now, unfortunately, this is going to hurt just a tiny bit. Just an itty bitty bit. It's going to hurt a little bit. I can't help it. It's your face is just one giant bruise. And I'm dying to know why. A secret? A secret. Do tell. You're gonna tell me how it happened. Come on. Well, if you didn't want to tell me, all you had to do was say. You really expect me to believe a giant monster got you right in the face. Okay. Oh, next time, guinea pig, make it a little bit more believable. I mean, don't get me wrong, I do believe that there are monsters in this world. But they don't look the way you're telling me they do. Most of the time, they just wear faces like yours and mine. Alrighty. Hold still. Oh, I know, I'm so sorry. I'm so sorry. It's all around your jawline. Seriously, did you just fall into some concrete or something, guinea pig? Let me see. Okay. Quite a little bit around your temples as well. Okay. Hold on. You haven't noticed any issues breathing, swallowing? No? Okay. What about anything hurting besides your head? Obviously, again, don't need to be a mind reader to figure these things out. It's pretty evident by your face. But tell me, how does it feel with bright lights? It's a little rough, okay? Makes sense. Okay. Did you at any point lose consciousness during this monster fight? No. Okay. Oh, you had somebody heal you. Okay. That's very sweet to say. Your friends had your back, huh? You guys are quite an interesting bunch. A little brag-tag team. Okay. And you haven't been feeling overly cold or anything? Haven't noticed any tingling in any of your extremities, any of your joints? No? Okay, good. And just for the sake of me asking, I know it sounds like you probably don't have a concussion, just a lot of severe bruising, which is going to hurt for a while, so maybe in about a week I'll drop off some more medication, see how you're feeling. Again, thank me later. Remember, I don't do house calls. It's not my fault that you're just so very special to me and what I'm trying to do. answer me this. How many of me do you see? Just the one, okay. And, how many fingers? 4, okay. And how about now? Okay, good. How about now? Good, okay. I'm gonna take you at your word, guinea pig, but you better not be lying. Okay. It doesn't look like you have too many gashes. Maybe like one right there, where the skin split with whatever hit you. Okay, we'll take care of those. In the meantime, let's first work on some of that swelling so you can feel a little bit more comfortable. Oh, we can talk about payment later. Oh, you didn't think I was going to let you get off free of charge, did you? I mean, I did say you wouldn't have to pay me monetary money, but there might be one or two things I wouldn't mind getting from you. If you're feeling up to it, of course. There's a perfect little guinea pig. Alright, I'm assuming this cafe has ice. Yeah. What about bags? Ziploc bags, just... They do? Okay. Why don't you go fill up a bag with ice for me, okay? Thank you very much. I would do it myself, but I don't really know my way around here. At least behind the counter. That's okay, I'll wait here. Try not to take too long. Is that for me? Perfect. Thank you very much for following directions so well, guinea pig. Nice and cold. Put a good amount in here too. Now, even when I'm gone, I do expect you to do this every so often. Let's say every 2 to 3 hours. Try to do it for at least, and I do mean at least, 15 minutes. At least. At most, no more than 30, okay? And you're just going to gently press these along. Usually I would say strategic points, but everywhere around your base seems to be a strategic point. So let's just say wherever it hurts the most. Anywhere where you feel any uncomfortable tightness, because the swelling of your skin is probably making it a little bit hard to move, huh? No, I'm not trying to make you laugh or smile or become too aware of it, but just make sure you do it, okay? It'll save you a lot in the long run, and it will help with the healing process. Oh, it's very cold. Okay. Alright. Now, hold still. Just going to come over here and just gently place this along the side of your face. That's good. I know, I apologize for it being so cold. There it is. It's getting a little too cold for you and me. Alrighty. We'll just count it down, alright? I'm going to press it all along the side of your face, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 9.5, 10. Good job, good job. I know, I'm so sorry, it's probably really uncomfortable. Alrighty, let's work on the other side. I'm just gonna press this everywhere. I apologize. I know it's so very, very cold. 1, 2, 3, 4, 5, 6, I know it was more like 12, but I want to make sure that you get the most out of this. Because knowing you and how you have a terrible habit of not taking care of yourself, I'm gonna have to do as much as I can while I'm here. Alright, let's come over here. Put this underneath. Alright. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, you got me. Alright. Very, very good job, guinea pig. Let's see, how's that looking? It looks a little red, a little inflamed, but that's a positive sign. That's what the cold should be doing, and it should also help numb the area so it doesn't feel as painful as we're waiting for the medication to kick in. Okay, we're gonna do it one more time. 1, 2, 3, 4, 5. You're doing a good job. 8, 9, 10. Good job. Let's go to the other side. I know it's really cold. There it is. Good job, guinea pig. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job. Okay. Would you mind tilting your chin up for me? Thank you. You even have some bruising down here. Interesting. Alrighty. Hold still. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. I was gonna make you go through that much. You're being quite a good patient. But I'm assuming it's because you went through such a harrowing ordeal that you will speak nothing of. Sorry, guinea pig. Again, I understand. Now remember, how many times did I tell you to do this? That's right, every 2 to 3 hours. For how long? That's right, at least 15 minutes. Alrighty, now, when did I tell you to take medication? That's right, 4 to 6 hours. Good. And how many pills was that? I don't mean to tease you, I just want to make sure that you understand my directions perfectly. I mean, I know you're very good at following the rules. At least when it comes to me. Oh, chilly. That's right, 4 pills. It's okay, I'm just teasing. I'm trying to lighten the mood, guinea pig. Right here, let me take a look at those little gashes real quick. Just really quick. Okay. Oh, you didn't think I wouldn't come prepared, huh? Knowing how often you get hurt. Honestly, I should just start keeping things around with me at all times. I mean, I would do that. I want to take care of you, guinea pig. You're not a bother, and you're not an inconvenience. It's my job as a doctor to take care of the sick. And those who seem to perpetually get hurt. Alright. Let's see. some out. Alrighty. Hold still. This is going to stink just a tiny bit. But I'll be gentle this time. Alrighty. Hold still. Just gonna gently tap, 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 and good. Okay, I'm just gonna tap, 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 and is there any more? No, one right here. Tap, 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 tap. There. At least I know they are clean and won't get infected. But most importantly, remember the ice, remember the medication, and something else I didn't mention, but it should be self-explanatory. What is it? What is it? That's right, rest. And this time, please take my word. I will even write you a note. Please stay home from school, at least for a little bit. This whole thing needs time to, heal. Plus, you look afraid. Alright. Just let me know if you need that note. I'll write one for you. Now, payment, guinea pig. So, unfortunately, I seem to have run out of samples of your blood. So would you mind if I got a teeny tiny bit more? Seeing as I can't run any tests on you now that you're hurt, it's a real inconvenience for me, guinea pig. At least a little something to tide me over. Please. It's the least you can do. It'll only sting for just a second. A small little poke. And then you're done. Yes. Oh, aren't you so sweet? Alrighty. Do you have a preference on arm? No? Good. Alrighty, let me clean it really quick. Alrighty, hold still. I'm just going to gently swipe, 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 swipe. Good, thank you. Now, would it be better if you looked away, looked while it was happening? Need me to count for you. Count, okay? No problem. Hold on. Alrighty. I'm just going to do it on the count of 3. Now, how about 5? Yeah, alright. And 1, 2, 3, 4, 5. I find it easier when people don't realize it's going to happen. So I hope you don't mind the little surprise. 3, now 5. And done. See, I told you it would only be a second. I only needed a little bit. I hope to be running tests again once you're better very soon. Little guinea pig. Alright, let me go pack up my things. Alrighty, well, I think that's all I can do for you. I know, our time has got so short, but someone is in desperate need of some rest. Wouldn't you agree? No, it's okay. You've been through a lot today, and you already overwork yourself way too often. Call it a hunch. A lucky hunch. So, off to bed with you. Don't worry, I'll lock up behind myself. I want to make sure that you head on upstairs and you stay there before I leave. You don't mind, right? Good. It'll give me peace of mind. Hopefully, gives you some too. Someone watching over you while you don't feel well. It's very important. It makes you feel nice and safe. Wouldn't you say? It's no problem, guinea pig. Well,